Most people with esophageal cancer are diagnosed because they have symptoms. It's rare for people without symptoms to be diagnosed with this cancer. When it does happen, the cancer is usually found by accident because of tests done for other medical problems. Unfortunately, most esophageal cancers do not cause symptoms until they have reached an advanced stage, when they are harder to treat. The most common symptoms of esophageal cancer are trouble swallowing, chest pain, weight loss, hoarseness, chronic cough, vomiting, bone pain, if cancer has spread to the bone, bleeding into the esophagus. This blood then passes through the digestive tract, which may turn the stool black. Over time, this blood loss can lead to anemia, low red blood cell levels, which can make a person feel tired. Having one or more symptoms does not mean you have esophageal cancer. In fact, many of these symptoms are more likely to be caused by other conditions. Still, if you have any of these symptoms, especially trouble swallowing, it's important to have them checked by a doctor so that the cause can be found and treated if needed. Trouble swallowing. The most common symptom of esophageal cancer is a problem swallowing, called dysphagia. It can feel like the food is stuck in the throat or chest, and can even cause someone to choke on their food. This is often mild when it starts, and then gets worse over time as the cancer grows and the opening inside the esophagus gets smaller. When swallowing becomes harder, people often change their diet and eating habits without realizing it. They take smaller bites and chew their food more carefully and slowly. As the cancer grows larger, the problem can get worse. People then might start eating softer foods that can pass through the esophagus more easily. They might avoid bread and meat since these foods typically get stuck. The swallowing problem may even get bad enough that some people stop eating solid food completely and switch to a liquid diet. If the cancer keeps growing, at some point even liquids might be hard to swallow. To help pass food through the esophagus, the body makes more saliva. This causes some people to complain of bringing up lots of thick mucus or saliva, spit, chest pain. Sometimes people have pain or discomfort in the middle part of their chest. Some people get a feeling of pressure or burning in the chest. These symptoms are more often caused by problems other than cancer, such as heartburn, so they are rarely seen as a signal that a person might have cancer. Swallowing may become painful if the cancer is large enough to limit the passage of food through the esophagus. The medical term for painful swallowing is odynophagia. Pain may be felt a few seconds after swallowing, as food or liquid reaches the tumor and has trouble getting around it. Weight loss. Many people with esophageal cancer lose weight without trying to. This happens because their swallowing problems keep them from eating enough to maintain their weight. The cancer might also decrease their appetite and increase their metabolism. Can esophageal cancer be found early? On this page show, screening is the process of looking for cancer or precancer in people who have no symptoms of the disease. In the United States, screening the general public for esophageal cancer is not recommended by any professional organization at this time. This is because no screening test has been shown to lower the risk of dying from esophageal cancer in people who are at average risk. However, people who have a high risk of esophageal cancer, such as those with Barrett's esophagus, are often followed closely to look for early cancers and precancers. Testing people at high risk. Barrett's esophagus. Many experts recommend that people with a high risk of esophageal cancer, such as those with Barrett's esophagus, have upper endoscopy regularly. For this test, the doctor looks at the inside of the esophagus through a flexible lighted tube called an endoscope. See test for esophageal cancer. The doctor may remove small samples of tissue, biopsies, from the abnormal area so that they can be checked for dysplasia, precancer cells, or cancer cells. Doctors aren't certain how often the test should be repeated, but most recommend testing more often if areas of dysplasia are found. This testing is repeated even more often if there is high-grade dysplasia. The cells appear very abnormal. If the area of Barrett's is large and/or there is high-grade dysplasia, treatment of the abnormal area might be advised because of the high risk that an adenocarcinoma is either already present, but was not found, or will develop within a few years. Treatment options for high-grade dysplasia might include surgery to remove part of the esophagus with the abnormal area, endoscopic mucosal resection, EMR, photodynamic therapy, PDT, or radiofrequency ablation, RFA. See endoscopic treatments for esophageal cancer. The outlook for these patients is relatively good after treatment. Inherited syndromes. People with inherited syndromes, sometimes called hereditary syndromes, that put them at increased risk of developing esophageal cancer, might also need frequent. For example, people with tylosis or Bloom syndrome should consider screening with an upper endoscopy after turning 20 years old. People who have family members with familial, inherited Barrett's esophagus should consider screening with an upper endoscopy after 40 years old.